Hi, I'm Dr. Ann Pendo, the Senior Medical Director for Experience of Caring at Intermountain Healthcare. And today I am excited to speak with Dr. Harland Hayes, who is the Chief Medical Officer for Utah Emergency Physicians in Salt Lake City, Utah. Welcome, Harland. Thanks for being here.
Thanks, Ann.
So one of the things that we like to start our conversation with is, what was your job both clinically and administratively like before COVID? And then how did you know things changed and what happened?
My job before COVID in the emergency department was bread and butter emergency medicine. It's a great way to practice medicine. A lot of variety, a combination of medical problems, trauma, take care of children, take care of the elderly, really anybody from any walk of life who is concerned that they're having an emergency comes in. And it's one of the great things about the job is the diversity and the breadth of the various presentations that you see. And so and administratively, what we try to do is we try to do everything we can to provide optimal conditions to care for these patients. And I'm part of an amazing team across Intermountain. Our group, we're an affiliated group, Utah Emergency Physicians, and we care for patients in 6 of the emergency departments from Ogden down through the Salt Lake Valley. And I work with the emergency department medical directors, and we try to come up with the best ways to create protocols and encourage providers and really make an amazing experience for patients while delivering just cutting-edge science and providing education and contributing to research. It's a great job. But our focus clearly took a sharp turn as conditions changed across the world, and that was a very sobering moment, that realization. You know, it has not been uncommon for various viral illnesses to, that are exotic, that kind of raise their heads and become concerning. But this one, as it became apparent that this was truly spreading across the globe and that it was coming our way, we jumped into action immediately. And I remember I was actually accompanying a high school group of my sons to New York City for this Model United Nations conference. And we were there as it was apparent that this was going to hit us hard. And actually the day we came home from New York was the day that the first positive case in Manhattan was diagnosed.
Wow.
But while I was there, my attention had to turn from the conference to multiple conference calls here and starting to get things in place. And it's been inspiring and overwhelming to work with phenomenal leaders in my group and throughout Intermountain, and even within the state to try and care for this population.
So it sounds like your focus was day-to-day work, mm-hmm. and then shifted to thinking really broadly, mm-hmm. and about something new and different.
Yeah.
So I know that you were one of our caregivers that traveled to New York. So after you got back from the trip with your son, traveled to New York to work in the emergency room in New York City. Tell us what that was like for you.
I am so glad that I went. I'm really grateful that Intermountain put forth the time and the energy and the resources to send 100 caregivers to New York. We were preparing for COVID here in our hospitals and in our communities. And we were really in a preparation phase while New York was in the thick of it. And we all saw that on the news. And as soon as I saw that, I had the same reaction that I think many of us had, which was, I want to be there. I want to help. And so I actually kind of started to look into some opportunities when I heard that Intermountain was going to send a team, and then we actively pursued that. And I was grateful to be a part of 7 of us from Utah Emergency Physicians that went to various hospitals. And I was in the New York Presbyterian Columbia Hospital. And it was sobering to work with them. We arrived clearly after the peak. However, the vast majority of patients that we saw were still very sick patients with COVID-19, and it was a very different environment. And I have nothing but praise for New York Presbyterian and for what they did under the circumstances. I cannot imagine a greater challenge than caring for that flood of patients and having to do so while worrying about caregivers getting sick, worrying about resources. And so it was really meaningful to go and to try and provide some relief for their physicians. They were very grateful. We bonded with them. We learned a lot, and I think there are some valuable lessons that we're able to bring back here. And we're caring for COVID patients here now, and I think Intermountain has benefited from the experience and the work that team brought back home.
What are the one or two things that you learned about the work, about yourself, about COVID between New York back to Salt Lake?
I think all of society now is pretty comfortable with knowing how to stay safe. Social distancing is not a new term to anyone now.
Yep.
People know hand hygiene is important. People are wearing masks. But as we were learning all of this, there was quite a bit of fear. And one of the most inspiring things that I saw early on, as Utah was starting to see a case here or there, and we were starting to try and keep patients safe and cohort those that potentially had symptoms, and we knew that this disease was more severe than influenza. We knew it was taking lives. We knew that it was more contagious. And so it was so inspiring for me to sense, the kind of the vulnerability in my partners and in myself and in the nursing staff. Yet, despite that vulnerability and some of those concerns, to see people show up to work every day. I remember one shift in particular, one of my partners came in, Dr. Shaneen Doctor, and he gathered the whole group together in the emergency department and invited people to share things that they were thankful for, invited them to share something that they were worried about, and kind of the bond that took place and the way people's wills were galvanized to move forward and to care for this population despite potential risks to themselves was really inspiring. And I've just been amazed at the sacrifice and the commitment that I've seen in the caregivers.
That experience that Shaneen Doctor created is potentially something that you wouldn't have done pre-COVID.
This was different. This was at the beginning of a shift, and this was not in response to a tragedy that we had seen with an individual. This was in response to kind of this unknown and this invisible, dangerous virus that we knew we were going to encounter, but we were still going to care for the patient population, and we came together.
So as we wrap up our time together, what are the one or two things that you would say you learned about leadership for you?
This reinforced to me that I am surrounded and that we are all surrounded by gifted, talented, thoughtful people. That leadership, at least within my group, leadership is not about telling people what to do. Leadership often is trying to be approachable so that people who are thoughtful, who read literature, who consider questions, who think outside the box, who raise concerns, it's enabling them to speak up and to get involved. It's trying to represent them. It's trying to coordinate efforts. And it's really trying, despite some unknowns and despite some fears, it's trying to maintain the focus on the two great elements of practicing medicine, which I think are loving the science and loving the people that you're trying to care for and having true empathy. And it's reinforced all of those. And it's been the most challenging and the most rewarding part of my career, no question.
Oh, thank you so much for sharing with us today.
Thanks.
We'll have you back, see how things are going in a few months.
Yeah.
Thanks so much, everyone, for joining us today.